For the first time ever, all but one of the surgeons general since 1992 have come together to denounce the head of the Department of Health and Human Services because he is a threat to public health in this country. So all but one of the surgeons general who have served since 1992, whether under a Republican or a Democratic president, have come together to publish this essay because they are so concerned about what RFK Jr. is doing. Keep in mind that in 1992, I was 12 and I'm now 45. So that's all but one surgeon general who served since I was 12. That is remarkable. So let's take a look at some of what they said. They said near the beginning, the profound, immediate, and unprecedented threat that Kennedy's policies and positions pose to the nation's health cannot be ignored. They say over recent months, we've watched with increasing alarm as the foundations of our nation's public health system have been undermined. Science and expertise have taken a backseat to ideology and misinformation. Morale has plummeted in our health agencies, and talent is fleeing at a time when we face rising threats. Repairing this damage requires a leader who respects scientific integrity and transparency. Kennedy has spent decades advancing dangerous and discredited claims about vaccines, most notoriously the thoroughly discredited theory that childhood vaccines cause autism. Kennedy continues to ignore science and the public's wishes. Most recently, HHS proposed new warning labels on products containing acetaminophen or Tylenol, citing a supposed link between prenatal use and autism. This move has been widely condemned by the scientific and medical communities, who have pointed out that the available research is inconclusive and insufficient to justify such a warning. I still have people in my comments weeks later telling me I'm a moron for saying this, even though all our major medical societies that care for pregnant people and children, including, as listed here, the American Academy of Pediatrics and the American College of Obstetrics and Gynecologists, has come out and put out a clear statement saying that Tylenol is safe to use in pregnancy when used as directed. I think this is really the crux of it. Rather than combating the rapid spread of health misinformation with facts and clarity, Kennedy is amplifying it. The consequences are not abstract. They are measured in lives lost, disease outbreaks, and an erosion of public trust that will take years to rebuild. Here they talk about how important people are to the mission of HHS and the fact that many have been fired and others have resigned. They say some of the top public health leaders who have left describe a culture of intimidation where scientific findings are censored, evidence is disregarded, and career officials are pressured to rubber stamp conclusions that are not backed by science. Finally, they say Secretary Kennedy is entitled to his views, but he is not entitled to put people's health at risk. He has rejected science, misled the public, and compromised the health of Americans. I could not agree more and just wish that they had explicitly called for him to resign.